morning. Please give me your full name, starting with my name is.
My name is Mary Baker, and I'm here from Boise.
And my name is Don Baker, and I'm from Boise.
Yes, my name is Fernando Portales Escobedo, and I live in Jackson, Wyoming.
Hello, my name is Kristen Cox. I have multiple myeloma. We've been coming and going from here for about 3 years now.
Well, I've been here about 4 months, 4.5, 5 months. I got cancer.
I had the leukemia transplant, a BMT.
The kids taking care of things in Jackson for you?
Yes, sir.
We hope so.
We draw from a large geographic area. Utah by itself is a large state, but we tend to have patients coming from Idaho, Nevada, Wyoming. They come and stay for a relatively long period of time.
Imagine that you're coming from out of town to get an opinion about some health problems that you've been having. And the medical team is asking if you can stay for a few days to do additional tests. And you hadn't planned on that. And so you're wondering where you're going to stay. Your finances are really tight, and you're worried about where you can afford to stay for the night.
We opened up a 16-unit apartment building for out-of-town patients, almost like a trial to see if it was even needed. And it became apparent very quickly that there was a huge need for housing for patients.
Well, we just got into the apartments here. My dad has had colon cancer. When he got here, though, it was just all of a sudden, you can see that he was alive again.
Been dynamite for me. It's close to the hospital. It's convenient. The stores are convenient around here.
Like I say, you don't have strange people walking around. Cozy.
It has bedrooms, so you can have your family stay with you and be comfortable.
Next thing you know, he was wanting to go outside. He was wanting to go for walks. He was out on the patio. We had a little barbecue out there. And it was just like, he was a totally different guy, you know.
Well, when I first walked in here, I was scared. I was leaving home, my privacy, our privacy. I thought, how are we gonna do this? We're coming somewhere strange. We don't know what the outcome is gonna be. I walked up them stairs and I walked into our room. And I felt the weight of the world off of my shoulders. I thought, we can do this. We're gonna be okay here.
The people who do well in their recovery when they're staying with us are those people who have family members who will say, it's time to eat, it's time to take that walk.
The ability to aid families to be present with their loved ones is immeasurable.
You're so worried about what's going on that you don't have a balance. And then all of a sudden, you have a balance by someone being with you. And you can explain things to that person that you can't explain to a doctor or to a nurse. And they're around all the time, so when you're sitting there and you feel like crap, you say, hey, look, I don't feel that well today.
Anybody who has a caregiver who's invested in that person, that patient is going to do much better.
You couldn't do it without her, right?
Right.
The need for this housing is very real. Right now, I have a mother and her daughter staying in my home because the housing situation is completely full.
We're usually 100% booked. We turn people away, and there's no need for that. So if we had a larger facility, we could accommodate those patients.
I don't have cancer. I don't have a significant health ailment that's holding me back. But to think of those families that are suffering in such a manner, and in such a manner that they need a place to stay as they're going through their treatments, it tugs at me. And if I can simply step in and to help these families, to be able to support the University of Utah Healthcare family and patient housing, it's a no-brainer.
Generosity has to start somewhere. It really begins with you, because you can make a difference in the lives of those people.
We really need you to donate generously and do it tonight.
There's people that has given us money right at a time where we've needed it to survive.
The need is great. We do need your donation.
It's such a nice feeling to be able to have a place where you can come back that's comfortable and you can do things where you don't feel like you're stuck in a hospital room.
It's our second home.